I want to share with you one interesting clinical case. This case was referred to my clinic. Chronic apical abscess, sign obstruct that you see, and a broken instrument inside. In mesial root, as we know, more than 50% of broken instrument they are in a mesial root of lower molar, mostly in mesial buccal one. And we see here the place of this long part of broken instrument. And important to me to show you that not always you must go and try to really to remove this instrument, because please remember the work of Harold Messer that says that if instrument and apical part under the curve, it's better not to try to take it out. We have two problems. One problem, it's overlargement of coronal part that may be risen with the time to create cracks and VRF. And second one, of course, danger zone and danger of strip perforation. And first of all, I try to create bypass here. And of course, I try to use data in some of the cases we have connected or merged mesobuccal and mesolingual canal. And one of the most important thing was the age of patient. The patient was 17 years old, and in this age, we have a very oval canal, and we have a possibility to do a bypass. I did a bypass, and you can see it on this X-ray. And also, I can show you that it was a real merging of the canal, and during aspiration, we can see how the sodium hypochlorite go through all the system. And by the way, we see also the broken instrument. After bypass, I don't think that a good idea to try to remove instrument. It will go out, it's okay, but it's not my goal. In most of cases with sinus tract, I use calcium hydroxide for 1 month to see the healing of sinus tract. But in this specific case, because the bypass procedure was very technical and sensitive, it was very important to create and curve an instrument and go from very specific angle. I was afraid that after 1 month it will be technically difficult to go again. And I used a system, SF system, to increase the disinfection. I use here during all my treatment combination of sodium hypochlorite and HEDP, continuous chelation. And after continuous chelation with SF system, I decide to finish this case in one visit. I finished this case with epoxy sealer named BGM. It's interesting epoxy sealer with macromolecule that can prevent biofilm formation with the time. And I follow up first time 1 month later to check if sinus tract disappeared. And I was very glad to see that sinus tract disappeared during 1 month. And the second follow-up I did 6 months later. And 6 months later, you can see very nice healing. And again, instrument inside. And we don't need to remove instrument in every case. And then by this approach, we can preserve health dentin. And I think it's much better than to try to remove instrument every case. I hope it was interesting for you. Bye.